Hi, good evening. I'm Dr. Pragnya Chigurupati. I'm a consultant breast specialist and an oncoplastic surgeon working at AIG Hospitals. As we all know that Cancer Day is coming up and it's on Feb 4th, and breast cancer is increasing at an enormous rate. You see a lot more younger patients getting affected by breast cancer, so I thought it was important to address the situation right now and make people aware of this disease. We had conducted an awareness campaign a couple of weeks ago, and we had all the couple of questions that I'm going to be covering over the span of the next few minutes are the most commonly asked questions. So here goes. The first question is that why should I know about breast cancer? Well, let's just say that breast cancer is the most common cancer amongst women in India currently, and it has surpassed even cervical cancer, which used to be the most common cancer earlier. We do have a vaccine for it now, cervical cancer, but we don't have any vaccine for breast cancer. So how do we prevent it? We should know about breast cancer because that's the only way you can prevent it, by knowing how to screen it. Breast cancer is not only a disease of women, but it's also a disease that affects men, although at a much lesser rate. Less than 1% of all the cancers are affecting men today, but the numbers are increasing. There has been a 45% increase in the number of breast cancers amongst men from the 1980s to around 2015, which is the latest census that we have. And in women, it is increasing at an alarming rate, although currently we have lesser numbers than in the West. Because of the change in our lifestyle and daily habits, the numbers are increasing. Currently, we have around 1 in 28 women being diagnosed with breast cancer in India, and in urban India it's 1 in 22, and in rural India it's 1 in 64, which is still quite a high number. That's the reason you should know about breast cancer. The next question is, breast cancer affects only those above the age of 50. Is this true? Well, it's not. The most common age group is between 40 and 60. That is, the average age group is around 45. But again, the latest consensus is showing us that the latest data, according to the Globocon data, is showing that between the ages of 25 and 40, women are getting affected to a much larger number compared to around 25 years ago, which is very, very alarming, because this is the age when they actually have children, they get married, and they have to breastfeed, etc. So at this, and plus breast cancer is even more aggressive when it affects the young. So people should be aware that it can affect women anytime from the age of 25, especially those with a strong family history of breast cancer or ovarian cancer, and it goes on till around 60 to 70 years of age. So it's not a disease only in those above the age of 50. The next question is, how simply can women do a self-screening at home, and what are the advantages? Well, self-screening, the best method is breast self-examination, in which women at the comfort of their own house can examine their breasts every single month. In premenopausal women, it's imperative that they examine their breasts after the cycles for that particular month, and choose one particular day and examine yourself on the same day every single month. Whereas in postmenopausal women, again, you can choose any one day of the month and examine yourself. How do you do this breast self-examination? Well, on the chosen day, you go and stand in front of a mirror, just undress yourself and just look at your breasts. Do you see any skin changes or any changes in the nipple areolar complex, anything which is abnormal compared to how it used to look before, or even compare it to the opposite breast? Any changes, it can be in the form of skin dithering, that is skin dimpling, any color changes, nipple being pulled in, any obvious lumps, any nipple discharge, you can figure it out yourself. And also, you should raise your arms and even examine the armpit and the undersurface of the breast. Once you examine yourself, once you inspect yourself, that is, you look at yourself in a mirror, the next step is to lie down on a bed in a semi-propped up position and examine your breast. For example, the left breast has to be examined with the right arm and the opposite with the right arm. That is, the right breast should be examined with the left arm. And the most common mistake that women make is examining like this. This is always going to show you something in the breast, because the structures which are in the breast are somewhat like little balls. So when you examine yourself, that is when you pinch it, you will feel like there is a lump. So the right way to examine is with the flat of your palm and go in concentric circles all over your breast from outside to inner. Squeeze the nipple, see if there's any discharge. And at the same time, even examine the underarms. If there are any new findings, please reach out to a doctor close to you. The advantages of this is that if there is anything new, you will figure it out in the early stage, and if it is a cancer, you can come and get treated, because today early breast cancer is curable. The next question is, I don't have any problem with my breast, so why should I go for preventive screening? This is a good question. The reason why you should go for preventive screening is because not every change in the breast is seen or felt. Sometimes there are changes on the mammogram or the ultrasound or the investigation of choice, which are something like calcification or very stage early breast cancer, which will appear only on the mammogram. Which is why you should keep getting examined clinically, as well as get an investigation based on your age, starting from the age of 40, around 45, I would say. Around 45, you should keep getting a mammogram done. So if there is anything that is detected, it can be detected at a much early stage and treatment is possible. You don't necessarily have symptoms every single time there is a breast cancer present in the breast. How is breast cancer diagnosed? Breast cancer is diagnosed by something called triple assessment, which has three different components to it. The first is clinical breast examination, which a doctor does for you when you visit her in the clinic. The second is imaging. For any woman under the age of 40, most commonly the imaging is with an ultrasound. Any woman above the age of 40 is with a mammogram. And sometimes you might require an MRI breast depending upon the composition of your breast tissue and the density of your breast tissue. So again, to reiterate, it's important that an ultrasound is done in any woman younger than the age of 40, because the density of the breast is very, very different in a woman above the age of 40. And along with the mammogram, you might be advised even an ultrasound to complete the screening, so the chances of any false positives or false negatives will be much, much lesser when it's a combined modality. And the third part of the triple assessment is a pathology, which is basically done by either a biopsy or a fine needle aspiration cytology, which is using a needle to poke the little tumor, if it's present, and suck out a couple of cells and send it for testing. And this will be advised to you based on your doctor's discretion. What are my survival chances after detection of breast cancer? What you should know today is that there have been a lot of advances in breast cancer treatment, and if unfortunately you are detected with a breast cancer, things are not as drastic as they used to be around 20 years ago. Remember that early breast cancer is absolutely treatable and curable if it spreads to the nodes, that are the little swellings in the armpit, that is regional spread, then the survival rates fall down. But unfortunately, if you present to us in the advanced stage, the survival rates are much lesser than in the early breast cancer, which is why it is important to examine your breasts and get investigations based on your age, and also know your family history of cancers, based on which you will be investigated and put on a surveillance from a much earlier age. Unfortunately, if at presentation the breast cancer has spread to multiple parts of the body, the survival rates are much, much lesser compared to presenting in a much earlier stage. So what should one look out for while selecting the right center for treatment for breast cancer? This is an interesting question. The right center is obviously important, but along with it, it's also important to find the right kind of a doctor with enough amount of experience in treating breast cancers. Because sometimes you might be suggested the wrong kinds of investigations because of or an under-treatment or under-investigation of the particular symptom, which in my opinion is not the right way to treat or investigate. So for example, in a younger woman, you might require an ultrasound to begin with, but do you need a mammogram or do you need an MRI breast? It completely depends upon the findings on the ultrasound and the age of the patient. If the patient is older, but yet the breast is very dense, you might be suggested a certain kind of investigation. So knowing the right kind of treatment and going to a center which has the necessary equipment is extremely important when you're getting treated or when you're getting diagnosed for any breast symptom. I got detected with breast cancer and I fear losing my identity because of surgery. Any options? Well, any woman who gets diagnosed with breast cancer unfortunately does lose their identity initially, but also loses their confidence. But because of surgery, what you should know is that every woman with breast cancer does not need to get a mastectomy, which is a complete removal of the breast. Today, based on the tumor size, based on the breast size and the age of the patient and the available resources, we can give the option of a breast conservation surgery, that is, taking only the lump out with a clear margin and add an oncoplastic reconstruction to that breast to give a similar looking breast to the opposite side. And this has proven to be oncologically safe, provided you undergo radiation. So you do not need to lose your breast if you have been diagnosed with a breast cancer. In that way, you can improve the quality of life of the patient. What are the advantages of oncoplastic surgery? Well, I just answered the question. It improves the quality of life of the patient because for a woman, obviously breasts are extremely important. And having a cancer in the breast does not mean that life should change. Life can go on in a similar boat except for the 1 year of hardship she might have to go through while treatment. And surgical oncoplastic surgery helps in regaining the quality of life by providing a similar looking breast to the opposite side. And this can be done with any sort of local flaps. It can be done with a whole breast reconstruction, which is again with parts of the tissue in your abdomen, that is in the stomach area below the stomach, or it can be used by done by even using implants or in a tissue which is in and around your breast. What kind of impact will breast cancer surgery have on the quality of life? Like I mentioned, you do not have to remove the entire breast if you're diagnosed with breast cancer. Based on a few tumor characteristics, including your breast size and your tumor size and your age, we can go ahead with a conservation surgery and a reconstruction. You have a similar looking breast to the opposite side. So, and besides this, even those women who undergo a mastectomy, the other options of having similar looking breasts externally are something called breast prosthesis, which can be either silicone based prosthesis which can be placed in a pocket inside the bra, or they can be foam pads, or there are a couple of woolen or cotton shaped prosthesis which are available at a very, very low price and via volunteers. So not only is it the quality of life can be amended even with external prosthesis, and you don't necessarily have to undergo surgery for that, which is why it's important to have all the range of options when you're undergoing a surgery. Can breast cancer be prevented? Unfortunately, it cannot be prevented today. There are a couple of trials going on at Cleveland Clinic in the US on vaccines for triple negative breast cancer, but we are at a very nascent stage and we do not have much information, but it is very interesting to know what the future holds for us. How can it be prevented? What I can say is that following good lifestyle habits, reproductive factors such as early birth of a child, breastfeeding, increased number of children, which does not mean that you increase the population, but it has been told that having the more number of kids, the better it is to prevent against breast cancer. But all these are, although we have it theory based, how much it holds true, we don't really know about this. So maintaining a good lifestyle is always important to prevent any kind of cancer, and that should be followed. Well, these are the questions we have so far. If there are any questions, you can put them up on a chat box right now. Or you can also email us on academics@aighospitals.com or Dr. Pragnya Chigurupati at aighospitals.com. We have started a breast health and gynecology center which is focused on all the women and any man also who's been diagnosed with a breast lump. It's basically a one-stop center where you walk in, get your investigation, clinical examination, and get a biopsy or an FNAC if required. So it's important, again, like I mentioned, to get a thorough examination of your breasts every year, and you have to examine your own breasts every single month. In any new change, please make sure you reach out to a doctor near you. Thank you.